The nasal bones are a pair of small, quadrilateral bones that make up the viscerocranium. Their superior borders and main bodies form the bridge of the nose, while the inferior borders connect with the nasal cartilage to form the superior margin of the nasal cavity. The two nasal bones are located in the region between the frontal and maxillary and articulate with each other in the internasal suture. With the frontal, it forms the frontonasal suture between the glabella and the upper part of the nasal bones. With the maxilla, it forms the nasomaxillary suture between the lateral nasal border and the frontal process of the maxilla. The nasal bones articulate with the upper part of the septal cartilage that articulates with both nasal cartilages, lateral and major alar, and nasal skeleton. The two bones, in fact, take part in the formation of the upper and anterior region of the nasal septum by relating to the vertical plate of the ethmoid. The nasal bone has two surfaces, external and internal, and four borders. On the outer surface of the nasal bone, around its midpoint a small foramen is present, the nasal foramen for the passage of a small vein. The convex outer face has the insertion of a facial expression muscle, the procerus, a pyramid-shaped muscle that superiorly fuses with the fibers of the frontalis. The frontalis muscle, corrugator supercilii muscles. The depressor supercilii and the orbicularis oculi depresses the medial parts of the eyebrows and wrinkles the skin between them. The innervation of the procerus comes from the branches of the facial nerve. On the inner surface of a nasal bone is the ethmoidal groove, in which the anterior ethmoidal artery and the anterior ethmoidal nerve pass through. The lacrimal bone is also a paired facial bone with a quadrilateral shape that has an outer surface divided into two parts by the posterior lacrimal crest. The anterior part, which is related to the lacrimal sac and lacrimal canaliculi, and the posterior portion, which is part of the posterior wall of the orbit. The part of the surface that lies immediately behind the posterior lacrimal crest is the place of origin of the orbicularis muscle of the eye. The lateral orbital surface is divided by a vertical posterior lacrimal crest with an anterior fossa for the lacrimal sac and lacrimal hamulus that articulates with the lacrimal tubercle of the maxilla to form the lacrimal maxillary suture, which with the maxilla forms the upper part of the nasolacrimal canal, which contains the nasolacrimal duct that allows the tears produced by the lacrimal gland, located in the lacrimal fossa of the frontal, to flow into the inferior meatus. In front of the posterior lacrimal crest is the lacrimal sulcus, the inner margin of which unites with the frontal process of the maxilla to complete the lacrimal fossa. So the upper part of this fossa lodges the lacrimal sac, the lower part, the nasolacrimal duct. The external surface is related to the lamina papyracea of the ethmoid bone at the level of the medial orbital margin. The internal surface is also related to the ethmoid bone, but specifically to its lateral masses, contributing to the formation of the lateral wall of the nasal cavities. The lacrimal bone also joins with the frontal through the frontal lacrimal suture and with the inferior nasal conchus for the lacrimal carpal suture.